everyone to our quarterly Define webinar. Really my pleasure to welcome our speaker today, Erin Autrey. Let me start off, in case you don't know me, I'm Susan Huang, one of the neonatologists, co-directors of Define, along with Dr. Tina Fisher. Now moving on to our introduction of Erin Autrey. Erin is the owner and founder of 3 Story Design, which is a holistic social impact branding agency and local social impact accelerator that connects the dots between collective needs, passion for change, concerted efforts, and strategic marketing. Her company bridges ideas, boosts results, and grows brands and social engagement to help our communities thrive. Many of you may be familiar with Tough as a Mother. That was really spearheaded, developed by Erin and her team. For today's presentation, we'll be focusing on the groundwork and ongoing development of a really innovative intervention to improve our families' transition from hospital to home in the NICU. Just so you all know, this session is being recorded. I think I was supposed to tell Heather before I started speaking, but I'm sure Heather knows by now to start recording. So I'll hand it over to you, Erin.
Sounds great. Hi, everyone. Thanks for having me today. Super fun for me to share, and my colleague Joanna sadly could not join, so she sends her well wishes. We're super passionate about the work we've been doing with Susan and the team, and kind of sharing. You may have even heard us speak about this project. We've been at it for quite some time, and we're always fortunate when we're afforded this length of time to get to know a project deeply in the way that we have. And I'll tell you what that means. And I want to leave plenty of time for feedback and questions and just things that you wish the platform might have also. This was a really valuable output session for me as well. So I'll kind of cruise through. If I feel very organic about the way I present, so feel free. I can't really see you, but call out questions along the way. Feel free. Or comments, but kind of just digging in. This is the audience that would know all of this best, so I'm not going to spend a ton of time here, but 11% of Colorado infants are admitted to the NICU. So whenever my firm is looking at a social impact situation and where we can make change, we're looking at, sort of the total addressable market, as we would say if this were a product. And so there is quite obviously a need, and this demonstrates a need in the community to do something to support folks that are not only in the NICU, but post-NICU and discharge. And obviously also address the gaps in care that exist when perhaps you're living in a rural community and there isn't care to be had. We know that Black birthing people are 1.5 times more likely to experience a preterm birth. So we have also different populations, and how can we address and support them better? And we know that families really do express, as we have learned and like to say, many hands to none with the discharge experience. So going from parenting with a community to essentially, I'm on my own and I'm trying to figure this out. And I also have unique situation, unlike most folks when they come out of having a baby and coming home from the hospital. And so a bigger learning was that there really wasn't, when we think about Define and the work that they're doing and the opportunity that we have with all the hospitals at the forefront of the work that the Define is doing, is that there was really no statewide specific centralized resource for NICU families in Colorado. And so why does that matter? And why is that? It's not earth-shattering to anyone here, I'm sure, but perhaps a family has met more than one level of acuity NICUs across the state, or perhaps a discharge nurse wants to give a resource, but the hospital system hasn't vetted that, and so it's not approved, and so they have to circumvent that. Those are kind of our learnings, and really what sets this project up for its why. We know at Post-NICU, we're really going to talk about moms today. That's not suggesting that we don't care about the partners, but this is really meant to be a solution for sort of postpartum depression, maternal depression, overwhelm, isolation for moms, the loss of the community that they feel post-discharge from being in the hospital community and having not only medical support, but other moms and families to rely upon and socialize with. And then the lack of these sort of inclusive, accessible resources, as I said. So what did we learn? I won't bore you to tears, but we did obviously, or not obviously, a lot of research to get to where we're going, which I'm really excited to present. We did a landscape analysis. What does that mean? We just looked nationally, even internationally, like what are all the existing resources for NICU families? What are they going to find on their own if they Google search? What are they getting discharged with? Um, what if they throw it in AI? What does AI say? What are all the sort of campaigns that exist and the messaging and the tools, all the things. And so ultimately, what you would want to know is there's more than 200 of them. So, what does that mean for moms that are overwhelmed, feeling isolated, maybe feeling panicked about a certain topic? It's we've just created more overwhelm for them. There's no vetting to this or a way to sort of siphon the information in sound bites to them. And that's really something that we hope to solve in our solution. And then Define really has this unique opportunity to sit at that cornerstone and do that work and sort of say, yeah, there's 200 plus resources or more out there, and that's great. And we're not here to say any one of them is good nor bad. What we're here to say is if we are doing and creating quality improvement and quality care, we can be more directive about what we send people to. So that's kind of what the landscape analysis helped us with. And then because we didn't originally set out to create a platform, and I'll share more about what that means in a bit, but because we started looking at technology as a solution, then we had to sort of push ourselves to look at what are all the technological solutions out there for NICU. These are sort of five that bubbled up. And then what we really did is looked at, well, what's great about them and what's still missing, and why would we create our own? Because the opportunities also exist. Tech is very expensive to develop. So we really wanted to hold ourselves accountable to not just create something to create it, but if it existed out there, and many of the resources that the platform will intend to use do exist, and we will use those as partnerships rather than recreate content on our own. So I won't kind of read all of this just again in the interest of time, but these were sort of five that sort of bubbled to the top of really powerful, amazing platforms. But still not one platform really solved what we wanted it to do. And I'm just going to look at the chat really quick. There you go. Yes, I can make the slides available. Okay. So again, in our research, what were we looking at? We conducted over 124 parent sort of feedback loops through interviews and surveys. Overall, we did 20 interviews. 12 of those were professionals in different roles, and 3 of those were or 8 of those were moms, sometimes even accompanied by their partner, and the dads sharing in the interviews. We looked at sort of across the geographic area that the hospitals in the Define kind of consortium cover. And we also sort of we're fortunate enough to have 6 professionals that also have lived experience. So this is a nice broad array, and there will be more surfaced on this work as we will put a report out on it. And then there's also some work that the university is doing to sort of shape up that as a more almost like white paper, I would say. These again are just a highlight, not extensive to all the different things that we found, but super important to note was that more than 70% of respondents had to travel more than 30 minutes to their NICU. That's important because now that they're back at home, they've got a time piece back to them, but also they're missing all that support system. So it just sort of relates to state of mind as they discharge and the complications they might have experienced leading up to it. Um, 75% of respondents had a single NICU experience with their infant, meaning they didn't cross over into different acuities of care. 65% had children at home during their NICU stay, obviously, again, compounding, support and potentially mental health issues. 68% had a singleton birth. Um, so I think this last bullet point is really interesting. So many of them had a familiarity with the NICU already, which I think is really important. One of the things we've talked extensively about it as a team is that when you go, if you're fortunate enough to take prenatal classes, I don't recall for me personally having any discussion of like, if you end up in the NICU, what might that look like? That said, our survey results said that 70% had somebody near them or close to them with a previous experience. 44% had a family member with a previous experience, and 29% had a close friend. So, what that says to us is that there might be more community out there for our NICU parents than maybe they're tapping into. Um, and then 18% of these folks had had a baby in the NICU before. So again, a prior experience. Um, the last piece is that over half of the parents surveyed were partnered, and then also highlighted that there were relationship difficulties as a result of the NICU experience. So that again signals to us that more support and care through the platform might be really warranted and welcomed. And then our sort of diversity is that 40% of our respondents were white and spoke English, mostly at home, which was 73%. That said, we'll still build an inclusive platform, but it just helps us narrow down like who might be using the platform, how do we build the platform for the largest population sort of first and foremost, or those that are most in need. So it doesn't necessarily mean just to these folks. This is just a quick map that showcases where the different respondents' babies were born, which was 27 hospitals across Colorado. And then this is sort of before and after, or during and after the next two slides of like what is difficult during the hospitalization and then what's most difficult after. So not surprising, NICU-itis, as they like to call it, getting tired of being there, being in the experience, ready to go home. The emotional roller coaster of it. My colleague Joanna and I were fortunate enough to do NICU tours with Susan. And I will say, having not experienced that myself, just the constant sound of a NICU is enough to, just cause distress, I think. And I'm sure you get used to it and more numb to it, but that was probably my big takeaway. One of my big takeaways of the experience was just the sound alone was very, it definitely attacked my nervous system in terms of keeping calm or not. And I didn't even have a baby in that particular NICU. Isolation, not surprising, a lack of knowledge, not knowing what one doesn't know, not knowing what or how to ask questions of providers, afraid to ask those types of things. The pressure of becoming an educator to family and friends when you maybe yourself don't feel like you have the education you need for you and your baby and partner potentially, and now having to turn that and tell others how they can support you. So that's a lot of weight on someone's shoulders. And then that feeling of also in tandem to that being behind in the knowledge and then the development of the baby. I'll just read this quote really quick. That came from our work. I can't even imagine trying to navigate any of what we did as English, not being my first language, or not having the education level that I had or the family support. So I feel like I'm a competent human being with a lot of resources at hand. And I struggled constantly with knowing what to access and how to get help. I think what helps parents' mental health is knowing your basic needs are taken care of and your kids have people organize the resources so that they can feel more confident leaving the NICU. So this was obviously advice giving on what could really support parents on a discharge. So themes that then percolated after bringing the baby home. Now we sort of set the what does it feel like in the NICU for families generally. Now we're home. Not again surprising. I'm the caregiver and the medical provider, so I have more roles than I had in the NICU per se. The NICU team became my family, and now that support system is gone. That's a huge loss. I think that we don't even talk about necessarily in terms of mental health. The losses in independence. So a lot of families, not only just the independence of having a medically compromised child that maybe needs more care, but also some cannot fly on airplanes or visit family far away, or their careers are impacted. Feeding in public can be challenging. The list goes on. So independence isn't just about as the individual themselves and being able to do sort of and go back to everyday activities. It's also about sort of all the unseen things. And then lasting trauma that may set in once the initial flurry of the hospital activity is gone. So I think a lot of parents sort of talk about that. Now I'm home, I'm back in my kind of normal home environment, and now I'm processing things that I hadn't processed for months. And then this is a quote from one of the NICU professionals that we interviewed. I think there's sometimes a perception that the NICU will be the hardest part, and then you go home and everything is normal. There's no mom that's ever been like, that was easy. It's usually just different. It's adjustments. It's just a different kind of hard. So I thought that was a really nice acknowledgement from the professional side, but also probably most moms would read this and say, yeah, absolutely. This is just a sort of, we also, we do quantitative and qualitative. And so this is coming straight out of the defined cohort survey from Q1 of 2025. And it's just saying that mental health diagnoses rose in parents sort of once they were enrolled and then once they were discharged from 18 to 27%. So that's quite a bit of a jump. And obviously, presents the case for why there needs to be some sort of solution post-discharge. This was probably one of the most not fascinating, but also very important things to learn from our survey, which is we live in a culture now that, getting someone's attention is really hard. As marketers, we know that. But we literally ask parents how they prefer to learn, especially in this context. And ultimately, listening to someone's talk about how to do something is 0% of people said they wanted that. And then, we only had 1% say they didn't want to say. But reading is at 15%. And I'll just speak for Susan's reaction to this is like, oh my goodness, we send people home with a whole packet. And the expectation is they're going to read it. And what we're seeing from this particular data point is that watching someone show you how to do something is actually the preferred methodology at 40%, or seeing pictures or diagrams. So again, we process that in a way that says, oh, well, we can do better. What does the post-discharge platform that we hope to build? How do we integrate that? How do we help, prior to discharge and discharge nurses, perhaps rethink this particular process and create new tools to have more efficacy post-discharge. We did also ask parents, like, what do they look at post-discharge on their own? And there was really no single go-to source. So, like, what I would liken it to is, if back in the day, I'm going to date myself by saying this, but once you learned you were pregnant, you would use Baby Center, which I think people still do, and then sort of track the developmental milestones. Nothing like that sort of bubbled up as like a go-to source per se post-discharge. And there were multiple sources given to us. So again, that just says to us a huge opportunity to surface something that is that go-to that everybody sort of agrees to and believes to be a really good resource. We did also ask about social media. This project was really originally meant to be almost community building, and so social media would have been a huge part of that. And I'm not saying it isn't going to be to this day, but there was really no sort of tracking that said there was one social media source that people followed for information and community. And I know it's funny to say social media and community, but truly, in our work with Tough as a Mother, we have learned that there really is such a thing as building community online in that way. And we're not just talking about followers, because ironically, in that particular space with substance use being the topic, we don't always have a true engagement because a lot of people follow the content without commenting. Therefore, we don't get the data that really supports how many people are absorbing it. Um, when there is a cross-system transfer between hospitals, I think that was the other big illuminating part for us was just that there's a lot of liability that limits sharing of information across those systems. And so again, not earth-shattering to build a platform, but the platform really solves something here, which is to say hospitals can agree to use it. It's not one hospital's entity. Everybody is pouring resources and support into the use of it. But when it stands outside of the system alone, it will have a different kind of use case and sort of answer to some of those liability and inconsistencies that we were seeing. And it was really important to note that there was a strong nod to community partners, hand to hold, and love for Lily. And that is a really important part of the platform development, in our opinion, is to increase the ability to create community and access these amazing nonprofits that are doing work on behalf of families. So I've already alluded to it. What is the solution? We're calling it NICU Bridge. That's just a working title. We are in the process of naming the platform itself, but it really has three prongs to it. The platform should really address feelings of isolation. And you say, okay, well, how does technology do that? Well, it's connection to resources, and there's ways that the platform can actually create an integration that allows moms to match with other moms in their zip code, maybe at the same developmental levels, all kinds of opportunity there in a platform. Empowers the mother in care coordination. So again, if there's ways for her to track things on her way after post-discharge and even connect it to her providers, should she choose to do that. There's a lot of empowerment there and a lack of feeling like I'm in this alone because I can log in, I can find my people, I can connect with them, chat with them, whatever I might do. And then obviously support mental health. And you'll see and hear some ideas around how we plan to do that. So in our world, we call this a minimal viable product. What is it? I will read this particular part because it's kind of crafted, and then I'll just say kind of the features of it. So the post-discharge NICU platform, NICU Bridge, as it's being called, is a comprehensive digital tool designed to support families transitioning home after the NICU stay, addressing their feelings of isolation, overwhelm, and lack of resources. It will offer telehealth services optimized for rural and low bandwidth areas, a localized resource directory, culturally responsive, inclusive materials for diverse populations, and tailored to support LGBTQ plus families. So what might be in this platform? Again, we're in the fundraising and sort of just the developmental part, and that's why I wanted to leave plenty of time for reaction. But they will have an ability to have like a customizable care tracker, and it's not just for baby, it's also getting the focus back on mom. So we know she kind of loses track of herself and her own care. And so it would be something as simple as when she logs in, maybe she just has a little barometer and it says how she's feeling today. And what's great about that, if anyone has ever journaled, is if you look back through several weeks, you can sort of see your own progress. And so something as simple as saying, I feel empowered today and I feel great and on top of things, or you know what? I've had 2 straight weeks where I said when I logged in, I didn't feel great. Maybe I need to talk, so it's just something to signify to her not only her own care, but also maybe tracking her baby's developmental milestones as well. In order to make a product like this really effective, we need a way to ensure onboarding and adoption. And so what we see is such an opportunity here that we don't always see in other product development or platform development is that we really can use the Define hospital system to ensure that this is part of the digital discharge like checklists that we create that for all hospital systems to potentially use. And therefore the parent is in, sort of already adopting, if they're creating them, we know they're motivated to discharge typically. And if the discharge checklist lives on the platform, now they're engaged in it, they're signed on to it, they complete that checklist, and now the hospital has a way to interact and sort of make that transition to home and onto the platform. We would ideally have symptom checker tools that help them sort of plug in things that might be happening at home to sort of, again, not replace medical care, but give them vetted resources, not just what they might Google and find, what we would want them to find. And then access to peer support groups. So as I mentioned, what we can do is geo-target. If I put in my zip code 80202, I can say the age of my baby, kind of there would be some criteria that I could put in and I could potentially match to other families that might want to meet or even join a peer support group through some of our nonprofit community partners. We obviously would have a vetted list of educational resources. Again, once they're curated, we have a little more control of what someone's consuming and know that it's the things we want them to consume. They also could have mental health screening tools. So all kind of in this holistic sort of care coordination platform post-discharge. I've already kind of covered some of this, signing up for the platform and how we intend to have adoption, the digital checklist as being that sort of qualifying event, if you will. And then also getting that mental wellness check-in, sort of once every time they log in, they kind of have to do that before they bypass into the activities that they want to do. And again, that's just a way to help. I think, when someone might be disengaged with how they're feeling themselves, it's just a nice quick check-in, and we would make it super simple. Again, similar things that I've already said, the video libraries, a lot of these, I'll give the example. I know there's some safe sleep videos that Children's, for example, created. But once we cross-pollinate to other hospital systems, we haven't always been able to utilize those amazing resources that were invested in and developed. And so by having it live on this platform, it's no longer in that hospital system. Therefore, the branding of it no longer, will matter. And because we have the QI group and the hospital systems to kind of vet this together, then we have this opportunity to now not cross out off of our list certain amazing resources just due to branding. There can be guides on there for siblings and family members. Again, that alleviates that pain point that families were feeling of being the educator. Like, let's just give them all the tools that they need, so that takes a weight off of them. Health literacy is such an important piece to this. And so we really imagine doing language guides, glossary of terms, and we even believe that AI has a lot of play in different parts of this platform, one of which could be sort of crib notes, which we know is already utilized in some NICUs, but also having the same way of saying, this is what I'm trying to articulate. Now put it in language that would help me articulate it better to the provider that I'm seeking assistance with. That's just one example. And then an ability, ideally long-term, that we would be able to have an Ask a Doc connection or a chatbot connection so that they really could get to families could get to care faster post-discharge. We talked about other tools like the symptom checker, but obviously financial guidance and insurance guidance would be really helpful. Appointment reminders. We know that moms and caregivers can be overwhelmed, so any little tricks that can help. And then that customized care tracker for them and their, baby that is more important to them. the emotional and mental health support. So we can ideally add some sort of screening tool. We can offer the peer mentorship program. And then ideally plug in virtual counseling and consultation services. To me, that's where, again, a lot of these things exist out there. The platform just takes it, curates these best of breed services, and really connects families to them in one way, so they don't have to go out searching. Or, as I always like to say, if anyone's ever had a crisis moment at a doctor and they go home with the 3 pages of here's all the people you could call to help you work through XYZ, and how overwhelming that is. So imagine just being able to log into a very vetted platform instead. And as mentioned, the mental health log. A lot of these have already been mentioned, but I think having a community events calendar is huge. Like, probably many people sort of miss out on really amazing events, especially virtual ones. And so sort of a curated NICU community calendar could be great. And then we always believe in storytelling for any work that we do. And so we're actually just signed on to begin that actual part of the process, which is collecting stories of the NICUs families, because again, not earth-shattering, but for example, with Tough as a Mother, as I said, we've really built an online community. And what we learned from moms is if they're having a bad day and they're maybe thinking about their sobriety differently in that day, and then they see a reel of another mom that maybe looks like them or is in their community, how that really motivates them to keep going on. And so, really highlighting these stories is just going to address isolation and say, I'm not alone in this. Someone else went through this exact same thing. And ideally, the platform could even connect them. I think most of this has already been mentioned, but I think this is a huge highlight to me, and you'll see this in the last slide. But we've never really had a way to connect that early childhood and early intervention support, but this platform could really grow to do so. And so simplifying like access to speech and physical therapy or occupational therapy through the platform, and even going so far as to helping with the transition to childcare and school. So those I think are really important, almost like a kind of a pathway to not being behind necessarily in school. And I think it's really interesting, all the studies coming out right now, the of COVID kids and those that are now starting school and that they're already behind. And these are not necessarily kids that had developmental delays. So how important is creating this pipeline? Again, this is really important to our work, which is the platform can build in tons of feedback loops and personalization, and also sort of dashboards that multiple users, if they allow, imagine if the provider could even look and check in and say, I'm seeing that maybe they've been struggling with X, Y, and Z. I could do a reach out. So I know that's a little pie in the sky, but ultimately it really would empower both sides of the equation, not just the families. Self-care and parenting tips, especially in building a social channel that complements this, would be great, because we know then we're curating content that they want, and even sort of family wellness plans, and sort of sky's the limit. But I think obviously there's some really important first features to have. And then again, this just really can reach all populations because it's a virtual platform. And we can really even connect folks to telehealth when possible, which is really great. And then also transportation assistance. One of the things we did with Tough as a Mother was integrated 211 as a white label to that particular website. And that alleviated sort of the social determinants of health and how to address them, since there's no one able to kind of keep up with all the resources. So that's just one play that we could consider here, which is searchable by zip code, pretty much everything under the sun through the 211 platform. And then just addressing sort of multiples or extended stays or ethnic or cultural communities. There's just ways that, again, just even in language development for all materials, you probably all experience this. You can go to a website and pull down whatever language you would like it to come in. And so there's just a lot of opportunity here of not having to have, 20 different translated one sheets in a discharge, experience, and rather being on a platform and pulling it up and toggling down to the language that you want. And then, of course, front and center, making sure that crisis and emergency resources are right at the forefront for everyone so that they don't delay, and essentially giving emergency action plans in there as well. So I think you can all see, I don't think I have to illuminate all of this, but obviously this platform can measure and really show us a lot of different ways that it's successful and sort of what we call, KPIs. But even just on how many families are enrolled, how many families are using it, how long are they using it, what are they using it for, could really, really help us inform better sort of discharge experiences by the learnings from the platform itself. I think we could really improve readmission rates with some of the information that we provide, and really ensuring that moms are getting the care that they need by getting reminders for follow-up appointments and even support in that. It could even kind of almost pre-populate for if they set it up correctly. And then early identification of developmental delays and connection to intervention. As I mentioned, we see that as a huge opportunity. The mental health and emotional support of it could be huge again because you're in your home, you are able to navigate a system at your own will. We know a lot about this in substance use in particular, as we call it the pre-contemplation stage or almost the shopping stage. And a lot of times people are afraid to ask for the help that they need. So by creating a platform where they can, we don't want to say self-assessment, that's not what we're here to do, but really empowerment is what we're trying to achieve. And again, AI has some really great opportunity here as well. And I know that can sound really daunting or depending on how you feel about it ethically, but the goal is navigation. It isn't advice giving or caregiving in that perspective. And then there's just a lot of operational efficiency that can come from this, and cutting down waste of materials printed and created, and just the amount of time a hospital discharge nurse might spend doing some of the work. The platform can really achieve some of it. And again, we're not trying to get rid of human interaction because we know that connection is important. For sure, equity and inclusivity and reaching in our most, rural communities, really gives us an opportunity to dive into not only just, message, but also making it feel more inclusive. And then, as I mentioned, these are sort of our broader whys, and I've already mentioned the early childhood system. And then it really is this sort of bridging the mental health intervention and the infant tool. I think there's so much focus on baby, and this really just brings it back to both. And then really an opportunity to inform policy and advocacy as a result of the interactions from the tool itself and how to improve discharge planning. And then really increasing voice. I think, unless we see these nonprofits and community partners really surface the amazing work that many of you do, it's sometimes lost in your own insular community. And so it really gives us a chance to collect and share out more broadly, more widely the work and the importance of it. So those are kind of the net of a bigger and broader, not just the discharge solution, but all the different areas that we can impact. And that is the presentation. I would love to hear sort of feedback and questions, and I'll take I don't think we need the slides, so I'll take that down unless anyone disagrees, and that way we can see each other.
Fantastic. Thank you so much, Erin.
Of
I'm
course.
sure the audience will appreciate how innovative and needed something like this truly is. Um, on Tuesday, we actually had a defined workshop that was really focused on identifying strategies to improve communication in the NICU, especially around transition to hospital to home. We had 6 NICUs participate and really commit to developing interventions and putting it into place over the next year. But what we kept hearing was, again, because as part of this workshop, we had families integrated into every working group, into every hospital specific meeting. And we heard over and over and again, Erin, exactly what you've highlighted, that they were thrown off a cliff with few resources and they did not know how to get the services that their baby or their family needed, on so many different levels. It seems like this thing, we've been calling it a thing, Erin and I, for some time, it offers, personalized approach to supporting families, not a generic solution, recognizing that all families are so different. The other piece that, you didn't necessarily highlight is that, during the communications workshop, we also heard limited bandwidth, that our nurses are too busy. A lot of smaller units don't have discharge coordinators. And so to expect someone from the hospital team to do all that this platform, this thing could potentially do, I think is really hard. And so therefore, I think of this tool as both family facing, but also hospital facing. How do we relieve the burden on hospital team members to confidently equip families for a successful transition home? Um, the other piece that I'll highlight and then I'll open up to questions is the other thing that we heard from families is that there is a vast amount of medical data, in that discharge summary. And somehow their outpatient providers are supposed to know all of it. Their primary care pediatrician, their OT, PT. And I'll tell you that there's never been a single general pediatrician who reads the 10-page discharge summary from the NICU. And so I also think of this platform as a way for families to communicate with their outpatient care team members in a way that's far more efficient, and actually effective than what we're currently doing in the NICU. Those were just some thoughts that I had as you were presenting, but let's open it up to questions.
Yeah.
And I can get us started. I know you have a lot of experience, Erin, on doing things like this, especially with Tough as a Mother. Can you highlight some of the potential pitfalls of something like this, especially in engaging with a high-risk population? We think about Tough as a Mother, it's a population that's affected by substance use. When we think about our NICU families, these are families that have experienced an incredible amount of trauma, and some of it probably not even processed yet. And so just curious to hear, what are some of the pitfalls in engaging with high-risk populations?
Yeah, I mean, I think from a communicator perspective, because by no means are we practitioners or standing in the shoes that you all stand in, but we have this through language, and we're very specific about language, but we can easily isolate somebody into believing like they don't fit the mold. So, like for Tough as a Mother, for example, we never talk about sobriety dates because we know that lapses occur. We don't want someone to feel bad. We know that there's a pre-contemplation stage that can go on for many, many years. The word we always hear is ready, which is really an interesting word when you try to piece that apart of like, well, wait, what qualifies ready, and all the different things that might have occurred for that particular person. And I might be standing there thinking, well, that should have been motivating, but that wasn't. And so we don't try to qualify what ready means. We just accept that it's the word ready. So I think I'll just say a pitfall is language, and ensuring that whatever we do, we're checking bias at all times, and nobody's immune to having it. And it's a lot of hard work, but that's probably one of the biggest pitfalls and things we strive to achieve is how do we make sure that nobody feels bad or left behind or that's not for me. And then technology is challenging because, you have to keep up with it. But I think that the rudimentary basis of this platform isn't based on a software update. It's about curation. And so that is actually something we can achieve and keep up with pretty well because we have so many amazing partners across this, United States and even internationally producing bodies of work that we aren't responsible for. We just need to curate them and say this is best of breed. So that to me is the exciting part, but can be the pitfall of any type of project like this is you're only as good as relevant of content that you create.
Thanks. Other questions, comments?
I don't have a question. I'm just curious and thinking about in Colorado, rural, mountain versus, urban. When you leave the NICU, you're still close to the NICU. And that's just on my mind often with our NICU discharges.
Mhm. I think that's the feature I'm probably most excited about is sort of, and we did this for another potential client where it was for nonprofit therapists to connect to other therapists to kind of debrief and have a mental health break with them because some of their cases are so difficult and yet they weren't baking in their own mental health support. And so the same sort of strategy that I think could happen here is that I could be a mom saying, I live at 80202. It doesn't really matter where I live. I have a baby that has, X, Y, and Z. And I just want to talk to another mom going through X, Y, and Z, and the platform could match us. And it's up to both of us to say, yeah, I want that. But can you imagine? And again, these things exist nationally. But to know that it's somebody sort of who understands the demographics and the lifestyle and everything that I may be going through, it just increases the connection. So I'm probably most excited. I know there's a lot of great features, but for other parents to feel and be able to connect or connect with a provider in a different way would be lovely.
Yeah, and in many ways, this could not entirely solve, but overcome many of the barriers that our rural families face, related to isolation and even lack of awareness of available resources. And then the ability to use the technology that has just grown since COVID so that they are connected to other folks who have similar experiences. I remember several families have shared with us that in the NICU, especially for those that were going home with durable medical equipment like tracheostomy or G tubes, they didn't want to hear from the doctor and they didn't want to hear from the specialist or the surgeons. They wanted to speak to another parent and learn like how they manage all of this at home. Like, what is it like having a ventilator in your house when you have other kids? Like what happened when your G tube fell out? Like how hard was it to get to the emergency room to have it replaced? Like those are the very practical kind of lived experience things that they wanted to hear about. And so the ability to connect with families, I think, is so important.
Yeah. One other thing I'll add that struck me in our work was how much guilt parents felt within the NICU. So if their baby was thriving, there's guilt about that because the open, like at least from what we experienced in our tours, it's a very open environment. You're very aware of not only what's happening with your own baby, but others. And so this guilt of if am I taking up someone else's time or is my baby thriving more? Or just imagine all of that guilt. Well, I'll just say all people feel guilt, but moms feel a lot of guilt and pressure. And so the platform's not going to tell them that they over exercise their right to ask a question. And so I think that it also alleviates that ask away, and hopefully the platform is answering it and they feel satiated, right? That's the job of the platform and the creation of it. But I do really feel like it could open up the doors for more question asking or more help seeking behavior than perhaps just in real life, which we like to make fun of, right? Like we want everybody to be IRL, as the kids say. But in this case, the virtual environment kind of can alleviate some pain points by saying, hey, ask away. The platform's not going to kick you out for asking that question.
Yeah, the other topic that came up on our workshop earlier this week is the difficulty in collecting post-discharge feedback from discharge families. For many of our NICUs, we have these patient experience post-discharge surveys that are sent out randomly by our hospitals. Response rates are very low. They're not tailored to the NICU population. And oftentimes the feedback doesn't really correlate with what families are reporting and experiencing in real time and what the staff is observing. Similarly, for those sites that participate in Define, you know that our families complete that post-discharge survey, and we get very high scores around communication in the NICU. And yet that's not reality, which is why we have a whole initiative that's just focused on, communication. And so I think of the platform as this really great opportunity to get feedback from families in real time in that post-discharge period. Can they share with their discharging hospital what was really difficult, what things went wrong, so that there's real-time feedback that's happening. And I think that's something that we can kind of program in, because frankly, for hospitals, that's a huge cost savings. At present, there's literally an individual, a nurse, that calls families to get some sort of information, post-discharge information. And so if there is a way that we can collect that more efficiently and frankly more accurately, it would be a huge help.
One feature of the platform I didn't really highlight, but it was embedded in the slides, is that there is an opportunity also post-discharge to really, in the first 6 weeks, so if everyone's aware, Bright by Text, which is now Lantern, moms, parents, family caregivers can sign up for developmental milestones and get these sort of pings that are not only just to the age of your child in a general sense, but also geographically located. So the example would be, I have a 2-year-old, there's a story time at my local library. If I'm signed up, I'm going to get a ping that says, hey, this Friday at noon, go join the Mommy and Me, reading group or whatever. We have the same opportunity to embed some technology like that, but we wouldn't obviously capitalize on developmental milestones. We can capitalize on mom's maternal mental health. And saying, hey, mom, have you checked in? It's been 2 weeks since your post-discharge. How are you, are you getting enough sleep? Are you drinking? We wouldn't, some of that's a little demeaning, I get, but like the point being is we have an opportunity to say, you matter. Like all the focus is probably still on baby, but here's some pings to say, you matter. Let's check in.
Other questions or comments? All right. Well, thank you all for participating. The work will continue. Erin and I will continue to work very closely to develop, name, and implement this thing that we hope will continue to grow iteratively, really based on feedback from hospital team members, but as well as parents, most importantly.
Yeah.
All right. Well, thank you all so much and have a great afternoon. Bye now.